Okay, you're live.
Hey guys! So today we're doing Morpheus8 on the chest, arms, and hands. So this is one of my favorite treatments because even after one treatment, you get to see really great results with it. So what this treatment is doing, it's microneedling with radio frequency. So we can change the depth and how far it's going down. So right now it's on the body setting. So it's going down to 4 millimeters. But what's even more amazing is because we're doing radio frequency, is that radio frequency even goes down even further, 1 millimeter. And so it's going down a total of 5 millimeters. So it's going really deep down into the skin. It's the only FDA-approved treatment for skin tightening. So it does not feel too bad at all because it's going deep down into the skin, so the patient only really feels a little bit of heat. So this is going to help with skin tightening. The thermal injury causes neocollagenesis, which is going to be causing that skin tightening. Other than that, we are also doing Fraxel, which is one of Dr. Emer's and my favorite treatments also for skin texture, tone, and different irregularities. So that's focusing more on the surface of the skin. Our patient also had a lot of treatments done a couple of days ago on Thursday. We did a combination of Clear and Brilliant, Microneedling, and the Rev Peel. So we're giving her a full makeover.
Can Morpheus go down 4 millimeters on the face as well?
On the cheeks, we could if the person has enough tissue in that area, but you want to be careful on bony prominences not to go too deep because it could be very painful. This treatment is recommended if you can do it quarterly, but there are people who love doing this treatment even more often than that because it really just helps to pump the skin up. It also helps with adipose remodeling. So that means because it's causing so much skin tightening, it's helping the skin to mold the fat into a different area essentially. So it kind of gives fat reduction, especially on areas such as like the face and the chin. And it helps to move that fat into areas where you want it to be. So it really is a treatment that helps with anti-aging, and I recommend making it a part of your yearly skincare treatments.
Can anybody do this treatment?
This is safe on all skin types actually, and the chances of post-inflammatory hyperpigmentation is very low, especially because with the Morpheus8, the needles are coated, and so all of that radio frequency energy is going just right down into the skin and not onto the surface of the skin.
Can you show us the needles?
Yeah.
Speak louder.
Oh yeah, perfect.
So going pretty deep down right now, and so all this crepey skin, after a couple of weeks, that collagen is going to build up and it's going to be a lot softer. And then since we're also pairing this up with Fraxel, you're going to see that hyperpigmentation, the skin irregularities, that's also going to go away. So really awesome to pair the treatments up. So I'm going to move on to the chest now. So we want to take it down, take the millimeters down because if we were to do the 4 millimeters, that would be way too much because the skin is thinner here. So we're going to go down to 2 millimeters for the needle depth, but we're going to do that radio frequency energy is going to go down even more.
How many treatments does one need to get rid of a post-op moderate scar?
That, because it's a scar, it is going to take a couple more treatments. It can be, depending on how severe the scar is, it could be anywhere between 6 treatments to possibly even 8. But if you're just doing it for anti-aging, you'll see really great results after one. But if you want to continue going with even more treatments, you could do 3 treatments, 4 treatments, just making it part of your skincare routine.
And how does this feel?
So she should just be feeling some heat. Correct?
I don't even feel heat. I don't even think you need to be blowing that on me.
No?
I haven't felt like I need that.
Okay.
Good.
Yeah. So some people will just feel heat, and then we also do use medical grade numbing, and so that also really helps with the comfortability of the treatment.
It does not hurt at all.
And do you feel anything at all?
Just
Pinching?
feel like, not even like a pinch, it's more like a little,
Like a tingling?
yeah, maybe like a little tingling, or not even that. It's actually kind of relaxing.
Oh, good. Lena, can you tell us again what this treatment is?
So this is Morpheus8. It is microneedling with radio frequency. So it's a little bit different than your traditional microneedling because of that radio frequency energy. This is also going much more deep than the traditional microneedling would ever be able to go down to. So additionally, because the needles are going down 4 millimeters, the radio frequency energy causes it to go down even another millimeter, which is a total of 5 millimeters on certain body, like certain parts of the body. You can't do it on all the areas. So now we're going to move on to Fraxel, and so this is a really great treatment for tone, texture, hyperpigmentation. So let's do that next.
I'm excited. What can she experience with downtime?
Downtime's probably going to be a couple of days.
Can you speak louder?
Downtime's probably going to be a couple of days, but it won't be too bad. Probably around like 2-3 days of like a lot of redness, and then after that, not too bad, maybe a little bit of peeling, mainly from the Fraxel, not from the Morpheus.
Okay, so tell us what you're doing now.
So now we're doing Fraxel, and this is the treatment that is going to be helping with the skin tone, texture. So it's one of Dr. Emer's and I's favorite treatments for the skin texture. Sorry. Ready? So this one also doesn't hurt. This one also doesn't hurt very much because of the numbing cream. Really, if she didn't have it, she most likely would just feel a little bit of tingling, and that's it. So all the treatments are fairly comfortable, especially when we use the numbing cream. These two treatments in combination, since the Morpheus is targeting the deep dermis and then this is targeting more of the surface, in combination together, she's going to get a really great result. You okay?
Yeah, it feels great. It feels like a massage.
That's awesome.
It feels like a massage. So, like I was saying, the Morpheus is going to be helping more of the skin tightening more deeper into the skin, and this is going to focus more on the surface of the skin.
What kind of energy are we using?
So this is fractional technology. It's a laser. So all these little, the laser is going to be causing little areas of thermal heat points, and so that's going to be leaving some areas of her skin intact while leaving other parts of it causing that heat injury. And so that heat injury is going to be causing the collagen repair in the body to start pretty much tricking the cells into thinking it's in damage to create more collagen, which is what the goal of a lot of treatments is, to build collagen in the area. So after this treatment, it's going to be important for her to treat her skin very nicely, so not rubbing her skin with the loofah in the shower, just kind of letting the water run over it, pat drying her skin, and then of course using all of the different skincare products afterwards to help with the healing.
Does this treatment melt fillers a little bit, or does it just depend on how long ago one has had filler injections?
So the Fraxel, no. The Morpheus, let's say the person got fillers that day, it could potentially, or within a week or two, it could potentially get rid of some of that filler. So we would want to wait a couple weeks before going in with the Morpheus, just because it's going so deep. But with the Fraxel now.
Okay, and somebody says that it looks painful.
No, not painful. She actually says it feels like a massage.
That's awesome. What do we do to treat before? What do we use to treat it before so it doesn't cause any pain?
Oh, so we put medical grade numbing on, and last week we actually did a couple other treatments on her. So we did traditional microneedling, and then we did clear and brilliant. And clear and brilliant, it's like your very mild, it's like your aggressive facial but very mild laser. And so it's between the two of them, that's going to be a really great treatment to just kind of do once a month. The downtime is not so much at all. It's probably just like one day, and then after that, I mean, ladies, you can wear makeup, and then other than that, we're going to be putting on the crystal fiber mask, so that really helps take down the inflammation and the redness. And then also the light stem, which the light stem, what that's going to do is help to bring blood circulation to the area, which will also help with the inflammation. So we do everything that we can to make you as comfortable as you can be during the treatment, and afterwards, after the treatment, we try and help you as much as we can to make sure that the aftercare and the aftermath won't be too bad. So that's going to be through the crystal fiber mask and the light stem, and further the skincare products that we send you home with. And you can find all of those products on our website.
And can men try this too?
Definitely. Yeah, this is good for men, women, anyone. We have people from young ages coming in for these treatments to very old. You know, you don't have to be a certain age range to come to do this, because we're always having to do skincare, and that's never going to change. So the earlier you start with your skincare, the less you're going to have to worry about it when you're older. So starting with skincare when you're younger is better.
What is this treatment for?
This is treating the surface of the skin primarily, so that's going to be targeting the tone and texture of the skin. So it's called the Fraxel machine. Not so painful at all.
Somebody's asking, what's the youngest age you have so far?
The youngest age, I think, was around 15. Of course, with the parents' approval and parents' supervision. You know, teenagers primarily are the ones that are getting a lot of the acne issues, so we'll do this right before a patient starts Accutane, for example, or after Accutane. But when they're on Accutane, we'll start with like clear and brilliant and facials, but this is safe for all ages, all skin types. We could always adjust the parameters to make sure that the patient won't be harmed in any way.
And what's the feeling like? How does this treatment feel?
So if she didn't have any numbing, it would most likely feel a little bit tingly. But since she has numbing on, she really doesn't feel so much. Almost feels nice, especially because she is post-op from a surgery, so her arms are a little bit swollen and feels a little bit nice. So after we finish up with this side, we're going to move on to the other side. We're kind of moving in increments, doing first the Morpheus8 and then doing the Fraxel. And as you can see on her arm, the Morpheus8 can leave you with pinpoint bleeding. And then this is leaving you a little bit red. So that's the clinical endpoint, just a little bit of redness and pinpoint bleeding with the two treatments in combination.
How long will it take for her to see results?
So, you know, typically once we do these treatments, it's helping to speed up your cells from essentially flying off. So normal cell turnover rate is 28 days, but because we're doing these treatments and the other treatments we did before, she's going to be seeing results a lot sooner, but approximately she'll start seeing some stuff once like everything has calmed down around 3 weeks, but she's gonna continue to see results even past that 6-week mark, 8-week mark. It's just your body's gonna continue to build that collagen. It's gonna take some time though.
Does it get rid of dead skin?
I mean, there's other treatments that are gonna be targeting that dead skin more. So for example, before we treated her last week, we did a salt facial on her, all the areas, and that really got rid of that dead skin on her. So when we did all the other treatments, it focused on that like good skin. So we were targeting that good skin that we're trying to have kind of come off, but not really so much dead skin. We're gonna move on to the other side of them, okay?
All right.